So, the origins. The age of observation, from ancient to classical. Firstly, I'm from India, so I would like to talk a little bit about Ayurveda. It is India's oldest medical system. People came up with it in 1500 to 500 BCE, before Common Era. So, what is Ayurveda? Ayurveda is like this type of a type of a medicine offshoot, which was drawn majorly from Vedas, especially the Atharva Veda. It was systemized by Charaka, Sushruta, and Vagbhata. So here is a manuscript from the olden days. I can't read it because it's in Sanskrit probably, and that old Sanskrit, so you know it would be difficult. What was the core philosophy? The core philosophy was that diseases arises from imbalance of Tridosha, and the Tridosha, the three means three, obviously. What are the three doshas? So we have Vata, Pitta, and Kapha. Vata is movement, Pitta is metabolism, and Kapha is structure. So the basic understanding at the time was health is equilibrium of body, mind, and spirit, right? Your body leads to a healthy mind, and your healthy mind leads to a healthy spirit. Here, prevention played a central role because, obviously at the time it was difficult to treat things with medicines and stuff. The major contribution that Ayurveda has had include the following. You have Sushruta Samhita, which was the first description of plastic surgery, rhinoplasty, and wound care. This is a copy of that. And here we have palm leaves of the Samhita, or the Sahotara Tantra from Nepal, which is stored at the Los Angeles County Museum of Art. The text is dated to be between 12th and 13th century, while the art is dated to be between 18th and 19th century. On this side, you can see some tools, shastras and kartikas, which are scissors and forceps mentioned in the Samhita. Now, the problem was, even with how good it was back in the day, people did all that they could, there were still limitations. The limitations included the following: that there was lack of anatomy. People had no permission or no opportunity to do dissections. There was no study of microbes. There was no understanding of physiology, and most of all, this was based on philosophical qualities, and not measurable parameters, which makes it very difficult to judge if it's good or bad.